Hi, my name's Brianna. I am a Track 1 junior, and this is my day in the life video. So my day in my life video is a little bit different because I wanted to film on my clinical days. And clinicals are when you go into the hospital to practice, and you can't really film as much because patient privacy. So I do have a few clips that I'm going to show later on, but for now I wanted to just talk through it a little bit and show you what clinicals are like, maybe share some stories and what you need to bring, stuff like that. So yeah, also I'm commuting, so it might be a little bit different because I do have to drive, but I didn't really film that because don't go on your phone when you're driving and it's not interesting to watch a commute. So I usually start off by waking up pretty early and I get ready. I put on my SDSU uniform and I wear an ID. We all have to wear IDs, and you get this from the school. Then I bring some supplies with me. So I bring just a pen to take notes, a Sharpie because we are often labeling things tags and dressings and all that. So you're gonna need a Sharpie. It helps. I'm doing med surge, so that's just general medical surgical floor. So think of if you're an adult and you get sick, this is where you go to the hospital. That's medical, and also the operating room, so surgical. And yeah, I also bring some scissors and a little pen light. This, I believe, came from the School of Nursing, so that's cool. And then I bring my own stethoscope. You have to get your own stethoscope. This is just a standard adult size one. I know they make smaller ones for pediatrics, but yeah, I just got the regular one. And I bring this all with me. I drive down to UCSD Hillcrest and we meet outside the doors at 6:45 a.m. with our professor. And we are on different floors on different days. We're kind of rotating through, and this is all kind of different because of Corona. So we have one less clinical day than we should. So one's virtual, one is actually at the hospital, but we're still doing it. So I think on the day I filmed this, I was just on a regular medical floor in that unit for the day. And you get assigned to a nurse preceptor. That's basically a nurse that you're going to follow around for the day. They can give you patients to take care of that are some of their patients, and you can do certain things to practice your skills. And of course there's limitations because you're not a registered nurse yet, but you are getting patient exposure, patient experience, skills, practice, all that great stuff. And you also get to practice charting. At UCSD Hillcrest, we get our own log into the Epic system, which is a system where you chart patients' information, which is just recording information about their status and interventions that were done. And yeah, so I'm just going to show you some of the clips now, and I'll tell you a little bit more about it later. This is the outside of UCSD Hillcrest, and I'm just taking the elevator up to my floor. There's my lunch, there's me. So this is a med room, and I just slowed it down a little bit so I could show you a little bit more of the Pyxis, which is that big unit right there. You basically put in a fingerprint ID as a registered nurse and withdraw any meds that you need. And those drawers are locked and they just kind of shoot out at you like a register. And yeah, that is a Pyxis. So here's just the rest of the med room. With some IV supplies for IV medications and anything else you'll need to mix or prepare meds. So again, sorry I can't record anything that has patient information in it. So I'm just in supply rooms where I know there's none, and I'm just showing you some of the stuff that you'll be working with in the future. And here's me with my full pockets on my snack break. And here's Whitney and I in the break room. And here's everyone else I have clinicals with. Yay! But that's kind of my standard days, just going in, getting assigned some patients, and working with them and trying to get as many opportunities as I can to practice skills. I'm there from 7 till 2, so it's shorter than a normal shift, which is a 12-hour shift for nurses, so 7 to 7. After that, I usually drive home, eat something and nap, which I think is what most people do. You're usually pretty tired after that. even if you had like a slow day, it's just so much is still happening and you're always learning so much that you need to rest after. So those are just some quick clips of the hospital, but I've been able to work with a lot more patients since I filmed it that day, and I've loved it so far. You get to meet so many different kinds of people. So if you like meeting people who have like interesting stories to share, honestly, it's really fun. And I really like caring for people too. So it's like making their day a little bit better, a little bit brighter. It just makes your day so much better. So those are my typical clinical days. I am also a co-director for Breakthrough to Nursing with SDSU SNA, which is our Student Nurses Association for this school year. And I invite you all to come to Nursing Revealed. It's going to be on April 19th via Zoom, and we're just going to be having a Q&A time and just sharing information about nursing school and answering any questions that you guys have. And more updates will be posted on our Instagram account, which is SDSU SNA.